And I'm going to share some slides with you guys. Oops. We're having so many technical problems today. Sorry, Darren. Okay, are we seeing my full screen? Okay,
Yes.
hi everybody. My name is Kelly Cleland. I'm the Executive Director of the American Society for Emergency Contraception. We're really excited to have you here today. We're going to talk about advocating for a vending machine on your campus that includes emergency contraception. We have some of our regional organizing fellows with us today, as well as Jasmine Shabazz, who's a member of our team. And we'll talk about why EC is important, some basics about EC. We'll talk about confidentiality and some issues that people often bring up around liability, some different strategies for getting an EC vending machine on your campus, and then we'll have some insights from our regional fellows and your Q&A. So we're going to try to keep our slides short so that we can really hear from you and to answer your specific questions. So this is our mission statement. We envision a world in which everyone has affordable access to EC without barriers or stigma, and we're working really hard towards that. You can see in this picture, Saray, who you'll meet, is one of our regional fellows, and this was actually the first time we met in person at the Society of Family Planning Conference last year in Seattle, and we had such a great time. So there are 4 options for emergency contraception, and some of them you may have heard of and some of them you may not. So the Yutsby method, this is kind of like the OG emergency contraceptive method. This is using regular birth control pills in different combinations. So you take maybe 5 or 6 pills immediately or as soon as possible after unprotected sex, and then another 5 or 6 12 hours later. There are specific combinations that you need to use, and there's certain kinds of hormones that need to be there. It has to have estrogen and it has to have certain progestins. So this is a little bit more complicated. You have to look online and find a table that describes the right dosages. But this might actually be easier to get for some people because it's usually covered by insurance. In places where it might be difficult for you to get Plan B or another dedicated emergency contraceptive pill, that might be easier. The downside is it's prescription only. The oral contraceptive pill, O-pill, that's over the counter, does not work for this purpose because it's a different kind of hormone and it doesn't include estrogen. This is not the most effective method, and it has more side effects because it has estrogen, but it's something we like to always include because we want to have all the tools in our toolkit. And I just want you all to know that this is a thing that exists. So Plan B is the one that most people have heard of. This is the one you can hand out on campus. You can put it in a vending machine because it's over the counter. That's a huge game changer. It's a really big deal. It's really just makes it much easier to get. The downside of Plan B is that it is not the most effective option. Ella is the prescription-only form of emergency contraception. It is definitely more effective than Plan B, and we'll talk about some specific instances in which it might be more effective, but I just generally want you to know for anybody using emergency contraception, it is more likely to work because it works closer to the time of ovulation. And we have another version of this training where we go really in depth on why and show you exactly how these products work. We didn't want to get into that level of detail tonight, but we can answer questions at the end. The downside of Ella is that it is prescription only. And so that means there are a few more hurdles to jump through in order to get it. And it is not always available. A lot of the work that we've done and that some of our colleagues have done shows that often Ella is not in stock at pharmacies the day you need it. And that is really important because all EC pills are more likely to work the sooner you take it. And then the final option we want you to know about is IUDs. You can use a copper IUD, or there's some new research showing you might even be able to use the hormonal IUD like Mirena. inserted immediately or, within the month after unprotected sex. There's research actually showing as long as you have a negative pregnancy test that you can use it anytime in the menstrual cycle. It doesn't have to be within 5 days. It is super, super effective. This is almost 100% effective. And it offers, 12 to 20 years of ongoing contraceptive protection if you want it. The downside is that you have to get a healthcare provider involved and that the insertion process can be difficult, especially if you're someone who has not given birth or been pregnant. So I'm going to toss it over to Jasmine. And Jasmine, I'm going to give you control of my screen.
Okay, hi everyone. So up next, we will be talking about the safety of EC pills. So there's a couple points that we want to discuss. The first one being that EC pills are safer than many over-the-counter drugs such as Tylenol, and that there is a lot of misconception around what emergency contraceptive pills do. So emergency contraceptive pills won't harm or terminate a pregnancy if someone takes it when they are already pregnant. And there are some side effects that should be known, including nausea, headache, and some menstrual cycle changes that are usually mild and go away on their own, but side effects can vary person to person. EC pills can also be used multiple times in the same month or year. There are no safety concerns, but EC pills are not as effective as ongoing birth control methods if you are taking them multiple times. In regards to the EC effectiveness and weight, there was a study a few years ago by a group of researchers. I believe that they were from the United Kingdom, and Kelly can correct me on that if I'm wrong, that had done a study on access to emergency contraception in which they were learning which women were more likely to become pregnant after using it. And what they found was that emergency contraception seems to be less likely to work with women over a specific weight. That weight is around 165 pounds, and this pertains to the levonorgestrel emergency contraception, such as Plan B or Take Action in My Way, and then there are some others. So this research suggests that levonorgestrel emergency contraception pills are less effective with users with a higher body weight. The evidence isn't always clear in the research, but the stakes are high when you are considering taking emergency contraception. For patients with higher weights, it's highly recommended to utilize ELA, the prescription ulipristal acetate emergency contraceptive, or get an IUD inserted from a provider. If that's not an option, you can still give Plan B or the other levonorgestrel emergency contraceptives. When we're talking about the effectiveness, it's not that Plan B cannot work. It's just that the efficacy of the pill is decreased. So like I mentioned before, emergency contraception cannot terminate a pregnancy, and it's very different than medication abortion. So levonorgestrel or ulipristal acetate emergency contraception is the primary ingredients, which are very different than medication abortion. And EC pills are used after sex, and they do not work if someone is pregnant, and that the purpose of the pill is to prevent or delay ovulation. So if you've already ovulated, the pill is unlikely to work. Versus the difference of medication abortion, where mifepristone and misoprostol or misoprostol alone are the primary active ingredients, and that medication abortion is to terminate a pregnancy to approximately 11 weeks. So why is EC access urgent? EC pills are more likely to work the sooner that they're taken, and it's to mitigate the barriers and delay increased risk of pregnancy for the person that's taking it. So pregnancy prevention is more urgent than ever, given the current legislation that's being passed in some states and federally with the reversal of Roe. It's very important that you stick to the EC window within the package. So individuals who also experience sexual assault need to take emergency contraception as soon as possible without interference and before or under the guidance of a provider as well. And there are many barriers that disproportionately impact vulnerable populations from accessing EC, which is why the work that we do is even more important. So what problems are we hoping to solve? Many college students and universities don't provide EC to students, which is why a lot of you guys are here. As well as not all schools have health centers or have accessible health centers. I remember talking to a student last week who said that their nearest health center was actually 2 miles from campus, which is not always accessible, and that hours of their health center are limited to during the week, and which makes EC even more inaccessible during the weekends. Some institutions also oppose contraception and do not offer that to their students. And like I mentioned before, that there are limited hours at clinics, pharmacies, and health centers that can impact access to EC. Also, as we all know, EC is very expensive. It can range from $35 to $50, sometimes more at pharmacies. And we want to make sure that EC is as accessible and as affordable or free as possible. There's also a lot of stigma surrounding EC use, and we prioritize the need for privacy, which is why methods such as peer-to-peer distribution and vending machines on college campuses are widely important. So what's working in our favor? So over-the-counter status is a game changer for accessing emergency contraception. So before, emergency contraception was required with a prescription, or you had to utilize a pharmacist to give it to you. There's also private sector innovation into emergency contraceptive access, and I believe that Kelly can talk a little bit more about this as well. And there are plenty of young people, much like yourself, that are fired up and ready to lead the charge in increasing emergency contraception access. And there is momentum on our side. You guys would not believe the amount of people that we have talked to in the last few days alone that have heard of college students that are having vending machines on their campuses, that are integrating peer-to-peer distribution models. This is a nationwide movement. So there are some facts that we want to give you all. So we are connected across 45 states. There are 125 schools currently that have successfully installed EC vending machines, with dozens more in the process. And that our project was launched in March 2020, and in just 4 years, look at how much progress that we have made on college campuses. I will now turn it back over to Kelly to discuss the confidentiality of EC.
Thank you. Okay, let me take Jasmine. I needed, oh, there we go. Stop control. Okay, awesome. That was really great, and love to jump into any questions that you have later. So I want to just talk a little bit about some of the legal issues that people ask us about all the time. A lot of times, this really pertains more to peer-to-peer distribution and handing out EC during tabling events. But it also is something to keep in mind if your university is worried about whether or not they can put in a vending machine because of liability. So first of all, is EC distribution legal? It is legal. You do want to double check state laws about if there's anything weird about distribution of over-the-counter medications. But as far as we understand, in most states, there are no legal constraints. And you can certainly reach out to us and ask if you're worried about this. There's very little risk of any kind of criminal or civil liability. And part of the reason for that is that, because it's an over-the-counter product, the FDA very tightly regulates what is on the box of the product. So all the information that an individual needs in order to safely use the product is there on the box. The FDA has decided that this product is safe for anybody to use. And that's why there's no age restriction and there's no need to talk to a healthcare provider in order to get it. Things you can do, though, to reduce any liability. You want to make sure you're not giving medical advice. And I'm going to talk about this in more detail. You also want to make sure that the product is stored at basically room temperature. You want to make sure the boxes don't have any tampering, that the product isn't expired. So there's an expiration date on every single box. And you want to make sure that you're maintaining confidentiality. So EC distribution HIPAA is not relevant. So a lot of people are concerned about HIPAA. HIPAA is specifically about protecting privacy, protected health information that is related to insurance companies and healthcare providers. You are not a trained healthcare provider by giving somebody access to emergency contraception. It's just like if your friend says, I have a headache, and you give them an ibuprofen out of your purse. This is not, so HIPAA is not in the mix here. If people start to talk about HIPAA, just let them know that that is not relevant to this discussion. You do want to make sure that you're taking measures to maintain confidentiality and or anonymity when you can. So that means, again, not relevant. Well, it is kind of relevant to vending machines, actually, because you want to make sure that if your school is putting in a vending machine, that they're not collecting a lot of personal information. Any information needs to be in a secure system. So whether that means if you have an EC distribution program on your campus, you want to make sure that it's in, it's as anonymous as it can be, and that it's secure so that not any random person on campus can access that information. And then you want to purge the identifying information as soon as possible. So we know a lot of people, if they have an EC distribution program, they want to collect information on who's using this service, how many people, what's their gender identity, do they live on or off campus, whatever that is. And that's great. You can keep all of that information, but make sure you're taking out their names and where you deliver to them. And then also provide a disclosure, if you can, on how this information is going to be handled that is given to volunteers. People often ask about whether the Dobbs decision, which is the Supreme Court decision that overturned Roe versus Wade, whether it applies to emergency contraception. No, it doesn't. EC pills are not the same as abortion pills, as Jasmine talked about earlier. And we want to highlight this distinction, not because we want to stigmatize abortion, because we are very, very much in favor of access to abortion for anyone who needs it all the time. We want to make sure, though, that people know which one they need and take the right one. If someone's pregnant and they take Plan B, nothing is going to happen and they're still going to be pregnant. If someone is pregnant and they don't want to be, or somebody is it's just had unprotected sex and they take a medication abortion regimen, that is a way more than they need, and they're going to experience a lot of side effects that are unnecessary. So you just want to be really clear on which one is which without stigmatizing either one. In general, abortion laws do not apply to emergency contraception. There have been a couple of states where weird things happen. So in Idaho, they interpret their state abortion law to include EC when it comes to public universities. So if you live in Idaho, you cannot get EC on campus from your university. So we are working with folks in Idaho to find where can we put a vending machine across the street from campus? How can we help students do EC distribution around their campus? Ella can talk a little bit more about providing emergency contraception in a restrictive setting because she goes to school at a Catholic university, just like I did. But we'll share these slides with you, but we have a couple of resources here about what the laws look like. So just back to medical advice for a minute. Offering medical advice is the thing that can open you up to liability. And it seems a little counterintuitive. We just were in the middle of a conversation with a student at a university who was handing out EC and thought she was doing the right thing in asking people questions like, when was your last period? When did you have unprotected sex? Oh, I think you're outside the window. I'm not going to give you EC. That is exactly the opposite of what you should do. Because then you're playing the role of a healthcare provider, which you are not qualified to do. I am not qualified. I am not a healthcare provider. I am not qualified to tell you whether or not it's okay for you to take EC. And if I do so, you can sue me for playing doctor. So do not give specific medical advice. And you want to look at your materials and make sure they don't give medical advice. We have actually, so these EC Quick Facts cards, we're happy to share these with anybody who wants some to hand out if you're doing EC distribution. I printed a bunch of these and then I had to throw them away because my attorney looked at it and said it looked like we were giving medical advice. And so these are our new ones, which do not have medical advice. And if you look at this last part, it says, instead of saying you shouldn't take EC if you weigh more than 165 pounds, it says some research suggests. So just make sure you're using language talking about research, talking about recommendations, but without telling people what they should or should not do. And we are happy to review your materials. You're welcome to use our materials, but if you want to use your own materials, we can take a look at it. And then use a disclaimer. So this is for informational purposes and it's not intended to be medical advice. Just like I had on, my other slides, this is not legal advice because also I'm not an attorney. And then you can use materials from well-established organizations. You can certainly use materials from the manufacturer. So if you're getting donated product from a company like Plan B or Julie, you can use their materials, but they are limited in what they're allowed to say because they can only say what is on the FDA approved label. We can say more because our recommendations are evidence-based. There's more evidence that is not reflected in the FDA regulations. So I would say use materials from an organization like ours or from like Bedsider. There are some great advocates for youth. There's some really good organizations out there. But just make sure that what you're using has been kind of looked at by someone with a little bit more legal knowledge. And again, we've got an amazing network of attorneys that would be happy to help. Medical advice is providing a professional opinion regarding what you should or should not do with your health and why you shouldn't do it. You're not trained. It opens up liability and it requires HIPAA compliance. So we've started really talking about this a lot and leaning into it because we just had a student get in trouble for doing this. And so we just really want to be super clear about this. Here's some things to avoid saying. Don't ask people about when they had sex, when they had their period, about their weight, about their medical history. Don't give them advice about whether they can take it based on what medications they have, whether it's been too long since they had unprotected sex, or whether they shouldn't use it based on their weight. You can say there's evidence that EC may not work for some folks. Here's a card, check it out, and if you have any questions, let us know. Or if you have any questions, even better, go to your healthcare provider, go to Student Health. So there are a few different strategies that we really focus on, and we're going to talk about vending machines today, but we also have folks working on peer-to-peer distribution and tabling. And we had a session on peer-to-peer distribution a couple of weeks ago. We'd love to talk some more about these other strategies if we have a little bit more time at the end. But this is like the most glorious thing. I used to learn I learned to use mapping software. And so I'm like super proud. And I want to show everybody my map. I love it so much. So the dark blue states are states where there are vending machines that include EC. And if you look at California, Washington, Illinois, Maryland, there are lots of them. And that's because they have state policy that either requires or facilitates campuses providing EC in vending machines. So we are hoping that more states are going to have this. We're also really hoping that we can turn these light blue states into dark blue states in every way. We want all the states to be blue. But this is where we are. And so one thing that we really, really like about this map, we also have a list on our website, which lists all the campuses that have EC, is that wherever you are, you can find a school that your school wants to be like. So, if you go to an Ivy League school, you can say, look, well, Harvard has it and Stanford, which is, you know, almost like an Ivy League school on the West Coast. Like you can, you know, or if you're a big public university, you can say, look, there are some huge public universities. Rutgers University is doing this. Purdue University is doing this. If you're an HBCU, you can say, look, Bowie State is an HBCU that launched a vending machine. So we find that is like really, really helpful argument, especially when folks are worried about whether it's legal in their state. Because you can say, look, Georgia's already got one, you know, there's 2 in place and two more on the way. So yeah, we'll talk a little bit more in detail about kind of where you all are and what is needed. But just in terms of legal issues related to the vending machines, progesterone-only EC, or we also call it levonorgestrel EC, like Plan B, it's totally over the counter. It's just like Advil. You don't need age verification. You don't need a prescription or a medical visit. You do not have to have anybody on staff who has any kind of medical license. So if you know, there are places where the vending machine is not on campus because the campus won't allow it, but it's in the feminist bookstore across the street. Nobody there is a doctor, but they can do it because this is an OTC medication. Most states don't have any laws at all on the sale of EC or OTC products and vending machines. And some states actually, as I mentioned before, have protective laws that allow it. One thing is that the FDA says that the OTC labels have to be visible. So when you walk up to the machine that you need to be able to read the label. I will tell you that this is not what's really happening in most places. It's a regulation that is really not enforced. But if you have a digital interface on your vending machine, it's really easy to do. If it's something that your campus is concerned about, you can just like put a photocopy up on the side of your vending machine that has the label. Okay, I'm going to pass it over to Ellen because Ellen has done some pretty tremendous work on getting a vending machine on her campus, and I'm really excited for you to hear about it.
Yeah. So hi, my name's Ellen. I she, her pronouns. I'm a second semester junior at Bard studying human rights, and I'm also a regional organizer for EC4EC. So at Bard last April, so a little less, almost 6 months probably, we were able to launch our emergency contraceptive vending machine. I can talk a little bit more about that, but let me make sure. Okay, yeah. So when you're getting a vending machine, it's super important to have administrative buy-in, especially if you want it to be on your college campus. As much as it would be amazing if students could just do all of this on their own, there is a lot that you can do on their own, and there is a portion that needs to be facilitated by administrators. And we do see that some of the most successful machines are machines that are supported by both students, administrators, faculty, and staff. So the more buy-in you can get, the better. And that's not to say that administrative support isn't difficult to get. It can be difficult, but also it can change over time. So in the beginning, my administrators at my school were kind of concerned, not super aware of laws and regulations. And once we sat down and really flushed some of those things out, they are super supportive of the machine. So the first thing to do is get students involved from the beginning. One thing about college that is great, but also is kind of works against students at times, is that every year somebody key in the movement graduates. And that is an issue if you're doing things by yourself, alone. It's something I ran into, thinking that I would be able to do it alone. As a sophomore, I had time. And now as I'm getting older, I realized it was really important for me to do those. If I had done these steps earlier, it would have been easier. It's something that you can rectify and change. But if you can start from the jump by having a group of students, now not every campus has a super supportive college student body. So if you can even have 1 or 2, 3, 4 students is better than one. No one's expecting that you're going to have 50 students, depending on the size of your school, supporting this from the initiative and all kind of giving the same support. Conducting a needs assessment is super, super important because it shows administration why you're asking for something. And so needs assessments can be super informal and they can be super formal. It kind of depends on what you're interested in doing. So if you are a, sociology student that's super interested in research and all that, you can do a formal survey, but you can also just send a Google form survey out to your campus community asking what EC access currently looks like. Some things that I did was when I was looking at, we had We kind of had a peer-to-peer distribution model at my school before our vending machine. I was not involved in it. And so I had a few friends test it out to see how reliable it was. And turns out it wasn't super reliable. And so that was super important for me to figure out and understand before I approached my administration about a vending machine, because they were like, we don't need this. We have a peer-to-peer distribution model. But after a needs assessment, I figured out that it wasn't actually something that was effective. Other things you can think about are, where around your college campus are students going for EC? Are they going to health services? Health services is only available 9 to 5 most college places. So does that mean that if, you know, students are having unprotected sex or something happen, that they only have access during 9 to 5? The realisticness is that most college students aren't putting their sex schedules around a 9 to 5. And, you know, like, that's just not realistic for everybody. You also want to think about accessibility. So yes, there's a CVS, but it is only accessible by a car, and not all students have cars, especially low income first gen students. Or you're thinking about, you know, is it in the health services building is on the second floor and there's no elevator, so those students who need mobility aids can't access it, things like that. And that's why it's important to gauge a broad sense of students and what access looks like, because you as an individual are not going to know all of the access barriers that might exist. Another reason why to have students involved. Things like timely barriers. So when is CVS open? How long does it take to get? How much does an Uber cost? So in total, maybe it costs about $100 to get EC, because the pill costs $50 and an Uber costs $15 each way, or you have to pay for your friend's gas, or, you know, all those types of things. Student demand survey. So one thing is that administrators might say, well, nobody said anything in the past, so everything must be good, you know? So also making sure that students are supporting this initiative because it's necessary. There's no need to put if your campus has a perfect peer-to-peer distribution where the administrators are paying students to do it and all this type of stuff, maybe a vending machine, you know, for some reason might not be the most, you know, best idea. I don't know. But the most important thing is that you show that students will utilize the machine, because there's nothing worse than putting all your energy and work into something and convincing administrators and then no one using the product. It going, you know, like that's very rarely going to be the case, probably never, but still you want to show that students are going to need the machine. Why EC is essential and time sensitive is a big thing to convey, and Kelly already kind of talked about that. Timing wise, it's super important to have things that are kind of flexible for students to go off of and have access right then and there. Yes, there is a 1 to 3 day period, or 1 to 5 day period for students to take emergency contraceptive. But I use this analogy. I was giving a presentation to another group, and I don't know if you guys on the same college, if your college campus work the same, but if you were to get a package at your shipping center, you get like an email saying you have to go pick it up. Very rarely do students go right then and there to grab it. They're like, oh, I'm going to get it. I'm going to get it soon. I'm going to get it. I need to get it. I'm going to get it soon. And then the day goes by and they send you another reminder email and you're like, oh shit, I forgot to do that. I need to do it now. I'm going to go get it. And soon enough, they're hitting you with the, okay, if you don't come pick it up today, we're going to send it back. And so the reason, because it's not in your schedule, it's not built in, it's not something that's like super easy to do. And so when we talked about it, my example was that if you have it conveniently located and the second you need it, the more likely you are to get it and take it, and the more effective it will become. ASEC, or with the parent company of EC4EC, has a ton of informational pamphlets, things like that. So there's no need for you guys to reinvent the wheel or go and do your own research. Like, that's great supplemental stuff, but you put your energy into advocating on campus and fall back on us for some of that more, you know, medical and other type of stuff. That way also you're not giving medical information, you're just like giving information. And peer pressure. It's a great way to do it. Administrators usually can be like, you know, I'm not sure if we want to be the first. And the reality is probably a lot of your schools are not the first private, public, HBCU, Catholic, or some kind of school to do it. There's been somebody who's done it before, which is super, super helpful. And so showing schools like yours. So, you know, I was a small private liberal arts college. I found many small private liberal arts colleges that had already done it in ways that they were kind of transforming their campus environments. And my administration was like, wow, you know, we really want to be like Vassar College, or we really want to be like this college. Let's get this initiative up and running to, you know, follow in their footsteps. Yeah, so there's 3 models for vending machines that you can do. One is to work with an existing vending machine contractor, which honestly is probably the easiest one, but doesn't always work out. So many of your college campuses already have vending machines. My college campus already had a snack vending machine. So what I did was I found the person who was in charge of vending machines on my college campus. That might be your buildings and grounds. That might be student accounts. That might be student activities. It might be student government. It might be your dining hall committee. And that kind of stuff goes around. You might have to go through some circles to figure out who exactly it is. But I was able to find the company, and most vending companies are actually local. So mine, I'm in the Hudson Valley in New York. So it was Hudson Valley Vending was in charge of our vending machines. And they have a contract with our school, basically saying that our school will pay them X amount of money and the vending machine company will take care of all vending on campus. So I asked my buildings and grounds, which is like our maintenance. And I talked with them and I said, hey, I need a vending machine and I want it to, mine was kind of like a different, a do-it-yourself and a work with existing. But I said, hey, is there any chance that you can give me a machine? And I will, fill it with EC and all that stuff. But it's easier if you can work with someone on your college. So maybe you approach them and say, hey, is there any chance you can service a machine that has condoms, lube, EC, all that stuff? And they may say, yeah, actually, we've done this before and we're super interested in learning about it. And it's wrapped up into your college's existing contract. Another one is hiring a full service outside vending company. So there's a lot of companies that you can pay a monthly fee or a yearly fee, and they'll put a vending machine on your college campus and do all of it. You don't have to touch it. You're not in charge of inventory, nothing like that. That is a very sustainable and very easy model. However, sometimes it can be more costly. Obviously, those services are going to cost a lot more than if you were doing something by yourself. And the do-it-yourself model is really super DIY-ish. So some schools have bought in vending machines from like Sam's Club or Facebook Marketplace and have a key and fill it themselves and kind of do that do it yourself model. That's kind of what my college does. And that also does have some fallbacks in it. So what happens when the person who, was filling the machine graduates? What happens when something gets stuck? You have to service it yourself, So there are gives and takes to all of these models. And as much as there's 3 models, most machines are a blend of maybe 1 or 2. And so I think these are more important conversations that we have one-on-one. So definitely after this, if you're considering a vending machine, feel free to reach out to any one of us, Ella, Saray, me, Kelly, and we can help you think more about that process. So some products to include in the machine, you can consider sexual health products, pregnancy tests, EC, condoms, lube, menstrual products, menstrual cups, first aid kits, Advil, and all that stuff. Harm reduction is also something that we have done in the past. Narcan over the counter, you can put in there, fentanyl test strips, all that type of jazz. Yeah, you could also be creative. What is your college campus looking for? What is it not looking for? We have in ours, we have UTI tests, we have menstrual cups. We had our health services sometimes gets these random promotional items that from like Walmart sometimes. So they gave us a bunch of deodorant and we put it in there, like really whatever you have a budget or access for or students would want to see. This is also something you can put in your survey when asking people if they would use a machine. What kind of products would you use in a machine? For example, we put drink test strips in our machine where you can like test if your drink has been like messed with in some way. And I thought that was a really great idea. And then I put them all in the machine and they all expired because no one took a single one. And I was like, why aren't people taking them? And then I thought to myself, oh, we don't go to a bar school. There's no bars around my school. So when people go to parties, they're bringing their own drinks. So if you're bringing your own drinks, people don't normally test them. So if that was something I had put in my demands, or not demands, my like demand, yeah, I guess, or like survey figuring out what people wanted, I would have realized and not had spent the money on that. So it's kind of you learn as you go, definitely. But each school is a little different and they contain different things. FDA approved over-the-counter birth control, Opill. This is something that we have looked into in terms of what Opill would look like in a vending machine. And we will be sure to keep everybody updated when that becomes something that can be included in machines. Some best practices to keep in mind. So you want to keep the price of an EC pill under $10. Kelly and the EC4EC team know a bunch of wholesale providers that sell EC at super low cost. So they're going to sell it to you for $4 or $5. for you to be selling it in a vending machine for $25, $30, $35. As close to 5 as possible. That's where most of our machines and our target range is. Some machines give out EC for free. Either the college has agreed to eat that profit or eat that cost and charge for other things from the machine. Say maybe they're going to charge for Advil in the machine and use maybe they buy Advil for $2 and they sell it for $4 and they're going to use that $2 of each Advil to pay for the EC in the machine. Some EC machines get their EC donated from the Plan B donation drive, which I think we'll talk a little bit about, or have before, and they charge, $5, and they use that extra money to supplement the other supplies in the machine that maybe they have to pay for on Amazon or things like that. Definitely adding other products to the machine reduces stigma. So for example, if you had a machine that was filled with EC and only EC, if somebody was going to go up to that vending machine, everyone will probably around them might realize that they had unprotected sex. And like, I have many of stories of when we did peer-to-peer distribution of people feeling that confidentiality was broken or, all these things because other people had seen them and all this stuff. And although we may have a stigmatized free notion of EC, not everybody in our communities do. And so the more regular everyday products you can put in there, like first aid kits, Aquaphor, are things that make it so students are less likely to be like, oh my God, I need to be in a little closed-in box to use this vending machine because they really could be getting anything. The more payment options, the better. A lot of schools use credit cards, campus cards. So like I go to Bard College, we have something called Bard Bucks, and like you can use them at the bookstore and things like that. If you can include those in your vending machines, again, these are conversations you're going to need to have with administrators about more logistical things. Cash, because some students only have credit cards attached to their parents' name. So cash is a really good option. If you have Tap, if you can make sure you have one that takes like Apple Pay and stuff like that, the more options, the better. Expiration dates. So if you outsource the machine, so if you're using a big supplier, like Simply Check, right? They're going to make sure Simply Check would run the whole machine and you wouldn't do anything. You wouldn't necessarily have to worry about expiration dates. My model, for example, a DIY model, we have a massive spreadsheet of all the products and when they expire and things like that. But when you normally buy EC, the way I think about it is you want to order smaller amounts to control and make sure that you don't have 100 of them left over with an expiration date tomorrow, because that's just honestly wasteful. So I order in packs of 50 and then, maybe we order once every month versus ordering 500. I go to a small college, so we're not going through that much versus ordering 500 and having them all expire and things like that, because you don't want to put anything close to an expiration date in the vending machine. You don't want to, if it expires in October, you might not want to be putting it in the machine in September if you don't need to be. So making sure you're keeping up on expiration dates and things like that. Storing is just most machines you want to keep inside, but there are machines that you can buy and work with that can stay outside. And there are more specific models and things like that, but temperature is not something you super have to worry about as long as it's in an indoor place. Some more best practices. You want to make sure your vending machine is in a centrally located building, ideally with some privacy, and you want to make sure it's ADA accessible, something that's open super late, things like that. However, we also understand that you may not have a centrally located building with a super private space that's ADA accessible and open 24 hours a day. And so, for example, I prioritize my location being ADA accessible, centrally located, and having some privacy, and it's not open 24/7. It's only open from 8 a.m. till 2 a.m. But I thought that from, the hours that it's not open 24/7, it was worth the accessible entrance and privacy versus the only 24/7 hour building in my school is the security building. So I was not going to put the EC vending machine right next to the security officer. You know what I mean? So it's kind of a give and a take, and you don't necessarily have to hit all the benchmarks, but some, providing referral information for condoms, ongoing contraceptive. So basically I can send you guys a picture on the outside of my machine. It's just covered in Canva graphics of all the different places you can go around Bard locally to get all of these different products and things like that. Again, not you giving medical information, but do you need more information? Check out these resources that are medically certified or things like that. But obviously with condoms and stuff like that, that's not a huge worry. So yeah, you want to make sure your machine is institutionalized. And usually that's not really a great word we want to use, but in this case it is. And so, for example, my vending machine was a DIY model. All of my Planned Parenthood friends were helping me fill it. And then once one of them graduated, I realized I was spending 7 to 10 hours a week unpaid of filling a vending machine, which is just unfair, ridiculous, and not honestly my problem after I put in the work of advocating for it. So I was able to work with my school for them to hire a student through our health services who is in charge of filling the vending machine. And yes, she still texts me and says, hey, I have a question about this when I'm training her. And then, yeah, but it cannot fall completely on your shoulders, ideally. Now we know that there are schools that are super restrictive, and the only way that you can have a vending machine is to have it be a student-led thing. And there are also groups out there that have much sustainable methods where there's 25, 30 kids involved in making sure this effort is sustained, versus 1 or 2 students that are interested in advocating and making it more institutional. Sustainability. So you're going to graduate, hopefully, fingers crossed. And we want to make sure that when you graduate, the movement doesn't die. It doesn't end with you. There's not a machine sitting in the campus center with nothing in it. The school removes it, and then they never agree to have the vending machine again because they feel like it was a waste of money. Yeah, so those are some of them. EC4EC has a ton of resources. Kelly and the team has spent so much time putting this together, and we don't want to duplicate work because there's so much other work that could be being done in the community. So feel free to check out our website. There's so many fact sheets and things like that. And yeah, basically any way we can help, especially with vending machine logistics. Sometimes it's easiest when I was working through it before there was regional organizers. I met with Kelly like once every 2 weeks, and I like told her, she knew all the administrators' names, and I was like, this is the problem I'm having. This is the problem I'm having. I can't get over this. And I really had to work through on an individual level because there's no model. Like, as tabling is kind of a more model that can apply to most colleges, vending machines can be super specific to your college campus. And so don't hesitate to reach out to any one of us to kind of set up times that work to make sure that you are asking the questions you need to ask and feel like you're getting the support that you need. Okay, I'm going to pass it off to Kelly.
Thank you, Ellen. That was fantastic. Ellen knows a lot. So I just want to show you our regional organizer cohort. This last fall was the first time that we used this model. You have 3 of our regional organizers with us tonight, Saray, Ella, and Ellen. They're amazing resources. So please reach out. They really work, very much regionally. So, but if you're in an area where we don't have somebody, like, they're all incredible at getting back to you and providing support. I wanted to just see, are there any specific questions? Let me just see oh yeah, we have a Slack channel. Hopefully you're all in it. If you're not in our Slack channel, please email us or put your email in the chat. Because we want to make sure that you're there. It's a really good place to get support, ask questions, learn from other people's examples, share your wins. We love to see photos and pictures of people when they finally get their project up and off the ground. I'm going to stop sharing so we can see each other. Does anybody have any questions that they want to raise? I see folks typing. Oh, thank you, Jasmine. That's awesome. Saray, while we're waiting for questions, I'd love for you to just talk a little bit about what your experience at Stanford has been.
Yeah, I was just about to unmute while we were waiting, but I guess I just want to say that when I came to this project, I was a freshman, and so I was a bit timid. And I think something that you might encounter is just your admin saying things that are not true, like they are not factual. And so it's really important for you to come with facts and data, and that can be really hard for you to bring up. So maybe even having someone with you could be nice, but just make sure that you go over the liability that we talked about earlier. And I forgot what the exact slide was, but it just had like a bunch of facts about EC, like how it's over the counter, like compared it to Tylenol, like just make sure you have those facts in your brain. It's also good to have data. So bringing the map of other universities in your region that have vending machines, also doing the survey, all of that can be really helpful. I think, yeah, because when I first approached my university, they were just saying a lot of things about how it needs to be over the age of 18, how it needed to be a certain price so that certain students won't have access to it who are younger. And at the time, I wasn't as equipped with this knowledge. So just make sure that you guys all have the information that you need to be ready. Yeah. And it's okay to be confrontational and kind and respectful, but you will need to do that because your admin most likely don't know a lot about this, just top of their head. So they're just gonna say things so that they don't have to pay for it, probably.
And you can get some great coaching from our fellows. They know a lot. Ella, do you want to just share a little bit about your experience at Loyola Chicago?
Yeah. So we are a Catholic campus, so we will not be able to have a vending machine. We've tried communicating with the administration, and the only thing that we can agree upon is having pads and tampons in all of the bathrooms, and that alone was a big struggle. So instead we do a peer-to-peer distribution model, which we had a webinar on a couple weeks ago, but if you have any questions about that, totally let us know. We've also been able to get around our university's rules by doing some tabling at nearby restaurants, which has also been super helpful. But yeah, our peer-to-peer distribution method is pretty much the only way that we are able to get EC to students directly.
Yeah. And Kai, I see your question. So Kai is in Louisiana. Kai is asking about if you get an off-campus location, do you need it to be approved by the college? And the answer is no. And that's the beautiful thing. So in a lot of the states that are more restrictive, this is a strategy that we're really leaning into. So we have a project right now in Idaho to try to get a vending machine across the street from Boise State. It's not going to be on campus because that is not allowed. But there are lots of cool businesses in downtown Boise where they already have like a basket of Plan B available. So we're looking to figure out how to get a vending machine. In Louisiana, there is one school that has a vending machine, and you can probably guess which one it is. It is Tulane. So it doesn't necessarily mean that just because Tulane has it, that you'll be able to do it. Would you just say what city your school is in, if you don't mind coming off mute?
Sorry, I didn't actually hear your question.
Oh, what city are you in?
Ruston, Louisiana.
Okay. Is that what kind of area is that?
It's like the middle of nowhere.
Okay. Are there businesses near your campus that you think would be willing to work with you?
Yeah, there's a couple near campus that we think that we could probably go to. It's mainly just the question because like our school also has like um a clinic, and so we were mainly worried that like if we started one off campus that the clinic might have like a backlash for it or backlash against us for it.
And does your school offer emergency contraception in their health service?
No, they offer Tylenol. It's like the main, that's pretty much it. They don't do condoms, they don't do like pads, nothing.
Okay. Yeah, so I would say in your case, Kai, I would say you don't need to, I would talk with folks in the community who might be willing to do this. There's no reason, like it wouldn't be taking any revenue away from the university, right? Because they're not offering the service. We do hear that pushback sometimes if like the university is making money off EC, they're selling it to students for $25, which is way too much. Then maybe it affects their business model. But if Louisiana Tech is not doing this, I don't see how they could be mad.
Mhm.
Or,
Okay.
or if they are mad, I invite them to stay mad. We'd love to help. So are you in our Slack channel?
No, I'm not.
if you're interested in joining, please put your email in the chat and I'll add you. But we actually have a fellow in Louisiana at Xavier, which is not only an HBCU, it is also Catholic. So she's got a lot of things that she's working on. But we'd love to put you in touch with Christina and see if we can figure something out for you. Other folks, people from Penn, Maddie from Penn, what's happening? I mean, at Penn State, what is happening? Because I know that there was talk about a vending machine at Penn State.
Yeah, so I'm not exactly sure because I kind of just got into this because I'm from Chicago. So like I got into this because I'm best friends with an abortion provider and she sent it to me. So that was kind of where I got into this. But I am reaching out to like the gender equity people and I know like the president of some of the clubs. So I was trying to see if maybe they had some thoughts, but we have like a lot of, I don't think we have any emergency contraceptives, but we definitely have like, we always have pads, tampons, condoms, like everything that people are passing them out the hub all the time. Like, and then it's always, if you go to the gender equity, like room, you can always get anything you need. I don't think there's any emergency contraception from what I can remember, but besides that, like we pretty much have everything else. So I feel like it's not like that like negative of a step. Like I feel like they'll be on board with it. But I'm not 100% sure. So that's why I wanted to come to this meeting too, to learn more about the actual vending machines, because I know we have kind of like people were talking about the peer-to-peer things, but we kind of have that, like you can just go in whenever you want to a lot of the buildings on campus. So
To get emergency contraception.
no, to get everything else, I think for
Okay.
emergency contraception, I think you just go to like UHS, like the
Okay.
University Health Services, or you can go to CVS, like there's a CVS on campus, and stuff like that.
Okay.
So
But
there's
it
also
probably
Planned
costs-
Parenthood nearby. Like there's a lot of things going on, so I feel like people probably just go there.
Okay.
But for everything else, like in the like sexual health category and like pads, tampons, things like that, like in every bathroom and all that kind of stuff. So
I feel like Penn State is a place where this could totally happen.
yeah, that's kind of what I was thinking. So that's why that's why I wanted to learn more. And then that way I can reach out to them and kind of coordinate. I also have a scholarship with the equity department. So I think if I talk to them, like they might be on board, but they also have a lot of like rules that are sometimes dumb, but they have a lot of rules. So I think they might not be able to be like as supportive, but I'm also a STEM major. So I think like since it's within the science department, they might be like, yes.
Right.
So we'll see.
I think, for you, I would say definitely connect with other students who, have been on campus for a while and see what's happening. And then if there are faculty that are, associated with, well, your medical school's in Hershey, right?
Yeah, the medical school's in Hershey. I'm a
Okay.
pre-med major though.
Okay.
So I am connected with like the pre-health advisors and stuff like that. And again, my scholarship's like in Eberly College of Science. So I think I have a lot of connections through them. So I might be able to find a way to make it work.
Okay.
I'm also a
But
junior,
yeah.
so I'm kind of late into this game, but I know that there's other people on campus that have probably been trying. So I think I have a bunch of resources that I'm going to keep reaching out to.
Awesome. Okay. Thank you, Sarai. We'll talk
Yeah.
to you soon. I'll see you very soon, Sarai. We're going to a conference in California. We're gonna have so much fun. Okay, what other questions do folks have? Let's see, Kai. We have multiple colleges, part of a small community that are interested in working together. Yeah, so could you get a contract that covers all of them, or would they have to be individually? So I would say if you're trying to get something in the community, there's really bye, Ellen, thank you so much. And folks, feel free to drop off if you need to. I'm happy to stay and answer questions. Let me turn off the recording. We don't need the recording anymore.